Hi, my name is Christine Foni and I'm working for UNMISS, and just like you, I'm opening this Casevac guide for the first time. When I was given this Casevac quick guide, I was told it was for emergencies, and especially when I go on field missions. The size is perfect for my pocket. I'm reliably informed that the Casevac SOP is the key document that explains the policy. They both need to be understood. Before we go into any details of what Casevac Quick Guide is, does anyone know what Casevac actually is? Why don't we ask someone who knows?
Thank you, Christine. I am Surgeon Commander Donald Angus. I'm a doctor and I help organise Casevacs and Medivacs from the Force Medical Office here in Juba. So, to answer your question, what is Casevac? Casevac is short for Casualty Evacuation. It is how UNMISS moves a person to expert medical care. It takes time, so it's very important that you do first aid while waiting. So, Casevac is moving a person who is very ill or badly injured from where they became unwell to where the best medical centre for them is. Sometimes we must be very quick, so we go by air. Sometimes going by road is best. Both are Casevac. A Medivac is a little different from a Casevac, and they are often mixed up. A Medivac is moving between medical centres. A Casevac is moving a casualty for the first time. Until someone comes to help, you are the best medical person there. Maybe you have first aid, self-aid, buddy aid, or even first responder training. And I hope you have a medical kit with you. I need you to do first aid while we do our bit. The more you can do, the better. UNMISS do first aid courses through IMTC. If you're outside an UNMISS base for a long time, you must have first aid skill and equipment. So, Christine, Casevac is moving a casualty to expert medical care.
Looking at the Casevac Quick Guide more closely, it appears to have all the information on the cover. Starting with the 9-liner, we have got the EGRA and the UNMISS. I wonder why they are repeated. Hold on page 3, it tells me to pull out the center page and complete them as soon as possible. Okay viewers, let me try. You need to keep yours stapled in one piece until you need to use them. So what is a 9-liner? And why does it need to be filled in first? Why don't we ask someone who knows?
Thanks, Christine. I'm Major Shahnaz from Joint Operations Center, that is JOC. To answer about your question, what is 9-liner and why we need to fill it first? Firstly, from the point of injury, you have to call FIOC or sector. If they are unreachable, then you can contact JOC. That is, all the numbers are mentioned in the Casevac guide. The first line, the location of the incident, is important to know where we need to get the help. The call sign and frequency is needed so we know who we are communicating with. This is so we can contact them back when we have further information. The third line, the number of patients and their priority, is so we know what to advise. Some patients may be best treated in a local hospital. The next line, the specialist equipment, is because maybe a car has overturned and the people cannot get the patient out of the car. We might need specialist equipment to help remove the patient safely. The number of patients by type is because if there are more number of casualties that are unable to walk, we will need more than one helicopter to assist them. The security at pickup site is to help assess what type of help can be given. The markup of pickup site is to alert the helicopter of your position. If, for instance, you have colored flares available in your patrol, you can state that they will be used to help find the site quickly. The number of patients by nationality is needed so follow-up support can be provided to the patients. The last line, the pickup zone terrain, helps by giving information so the air crews know what area they will be entering for everyone's safety. When JOC receives this information in the 9-liner, we can work with all the areas of the mission to get the help to the patient as quickly as possible.
To recap the 9-liner, it's informing the mission of the key details of accident and incident because we need to get help to the injured as soon as possible. We are told that the EGRA, or the Emergency Ground Risk Assessment, should be filled in next. What does it contain and why is it necessary?
Thanks, Christine. My name is Lily and I work in aviation. So to answer your question, what is EGRA and why is it necessary? EGRA stands for Emergency Ground Risk Assessment, and it is designed to give those assessing on the ground at the point of injury a quick guide on what can be done for the safety of the patients as well as all personnel involved. So by filling in this page, you're focusing on the area. As you are there on the ground, you have the eyes and the ears, and you will need to share this information. This will allow aviation to visualize the scene and help them to get to you as quickly as possible. So this is why EGRA is so important. So let's look at the guide in more detail. Number 1, present situation in the location, and number 2 is their fighting in the immediate area, are looking at whether this is a quiet or relatively hostile area. And so aviation can assess what mitigation measures need to be put in place to land there, or to suggest moving the patient to a better, safer location if possible. For number 4 and number 5, the sentiment of controlling forces towards UNMISS in the immediate and surrounding area. What we're looking at here is to know whether this might be an area that is popular with the UN and patrols are frequently using this route, or if maybe it is an area that is preventing anyone from entering. The flight crew needs to know this so that they can make assessments and give accurate advice. Number 6 is to alert the aviation team as to whether there's a presence of friendly forces available to secure the landing site. Number 7 is your assessment as to the overall security situation in the location. And finally, number 8 is your recommended risk level. Remember, as the person on the ground, your opinion is necessary and valid to help assess the emergency ground risk.
To recap, the EGRA is informing the mission personnel of the key details of the situation at the landing location, so as to mitigate the risk for the safety of both the patient and the crew. The final form is the UNMISS. It covers the patient's health, who fills in, and what happens to it next. Also, there's 10.1.2. I'm so confused. What does it entail?
Thank you again, Christine. Answering your question, who fills in the UNMISS, is easy. You do. But it is important to do well, so let's talk about it. A full UNMISS tells any doctor the most important information about a patient, so that we can plan how to help. For any medical emergency, deal with the patient first. Paper can wait, but patients do not. If someone else is free, tell them what to write. Otherwise, you can write it down as soon as you are free. Each letter of the UNMISS means something. A is for the age and sex of the patient. So we know if we need to do something special for a child or an old person. If you don't know and the patient can't tell you, just say about 30 years old or young child. Please notice, we do not want their name. This is so that we can keep medical information private. T is the time of injury, so that the doctors know how long they have. If you send a second UNMISS message as an update, make this time the time you wrote the newest set of observations. M is for the mechanism of injury. What happened? Be specific, but it can be one sentence. Maybe they fell off a 2-meter high wall. I is injuries. What injuries can you see? Or do you think that they might have? Do your best here. I would rather a guess instead of nothing. Signs and symptoms. These are what you can measure and what the patient can tell you. If you know how to do each and every bit, please do. If there is one part that stumps you, please just move on. T is treatment provided. What have you done? Please write down as much as you can. What happens next? Well, the information on the UNMISS is sent by any means to the FIOC, sector, or perhaps direct to the JOC, who will pass it on to my boss, the Chief Medical Officer. This information is how we learn about your patient. You should place the actual paper inside the patient's shirt so that any doctor can quickly learn all they need about the patient. Christine, you also asked about 1012. It's a planning tool to help decide how soon emergency care should be available. In the first 10 minutes, the first aider, that's you, saves the life of the patient. Please focus on stopping very big bleeding and helping the patient to breathe. Within 1 hour, we focus on getting the patient to a medical centre to give professional help. The patient should have a surgical operation, if needed, within 2 hours of an injury. But as I say, this is a planning tool. Some parts of South Sudan are more than 2 hours from an operating room. We can still go to these places, but only after more careful thought. Please always know where your nearest medical centre is. It may be best to go straight there, but if you do, please tell us what you're doing.
So to recap, the UNMISS is informing about the health of the patient at every step of evacuation, so the medical team can assist them as quickly as possible. The 1012 is not to worry about. It's to keep at the back of our mind when responding to a critical patient. Well, it has been very interesting sharing this information with you. I certainly have learned a lot. I feel I should now sign up for the first aider course because time is very important when saving life. Now I know when I go on patrols, I must ensure I have my medical kits, drinking water, Casevac quick guide, because when I have it, it can save life. Thank you for watching this video presentation on the Casevac quick guide. Stay safe, stay healthy.